Hey everyone, I'm Lauren Fleming, the founder of Him Supportwear, and today I have Lillian Medhus with us. She is a doctor of nursing practice. She's a board certified women's health nurse practitioner and a certified nurse midwife. She has over 11 years of experience working in women's health and specializes in sex medicine, pelvic pain, and hormonal management. She's currently full-time faculty at an MP CNM practice, and she's opening a boutique practice called Aspire Women's Wellness. Aspire is a sexual, gynecologic, and hormonal health clinic that focuses on long appointment times to build relationships with patients. Aspire is available in person in the Dallas-Fort Worth area and telehealth in Texas, Minnesota, and California. We are so excited to have you here with us today, Lillian. Thank you for taking the time to talk with us.
Yeah, thanks for having me. It's nice to see you.
Can you tell us a little bit more about your background and what inspired you to go into this space?
Sure. So I went into undergrad nursing school knowing that I wanted to be a women's health nurse practitioner. And then after undergrad, I worked as a nurse in postpartum and newborn nursing for a little while, and then went to graduate school to be a nurse practitioner and a nurse midwife. And what really inspired me to begin with was I was looking around and I noticed just in a lot of the spaces, I was a volunteer. I worked in a domestic violence agency, helping run support groups for women, and volunteered in some different areas in my community. And it just seemed that it kept coming up that women's health was an area that just seemed to be neglected or didn't have enough providers that really cared about women. And so that's where I first got my passion to serve women specifically. And then when I was an undergrad, I had a faculty mentor who was a midwife, and I learned more about what midwifery care was. And so decided to pursue both being a nurse practitioner and a midwife.
Excellent. Thanks for sharing that with us. Can you tell us a little bit about what a typical day or maybe typical week looks like for you?
Sure. So my typical days look a little bit different than they used to. So I was in full-time clinical practice until recently. Then I started teaching. So now my days mostly consist of teaching nurse practitioner and nurse midwife students. And so that means meeting with them, doing a lot of mentorship. I do a little bit of teaching specific to areas of interest of mine, like sex medicine and pelvic pain and pelvic floor dysfunction. And then in my clinical practice, what a day might look like. I tend to have a mix of patients. Some come to see me just for annual exams. Routine health maintenance. We're talking about how to stay healthy, what screenings do we need to do, that kind of thing. And then patients with more specific concerns. So it might be sexual concerns like low libido, difficulty with orgasm, pain with intercourse. Gynecologic concerns could be anything from urinary incontinence to abnormal uterine bleeding. And then I see a lot of patients in the perimenopause stage, and we talk about hormone therapy, lifestyle management, so a lot of different things.
Great. Yeah, it sounds like definitely covers the gamut of I feel like women's health kind of through the lifespan of things that we may encounter.
Hmm.
Great. Um, One of the things I like to talk to people about is how do you explain the importance of pelvic health to somebody who maybe doesn't know a lot about it or hasn't heard about it before?
Hmm. Yeah, so I have a lot of visuals in my clinic. So I have a pelvic model, I have a lot of different diagrams and stuff, and we really talk about how, um, for many of the reasons patients are coming to me, their pelvic floor is a main contributor to the symptoms that they may be having. And so what I do is I just explain to them the anatomy of the pelvis, how the muscles work together to support the bladder or to allow to have intercourse that's not painful or to help them achieve an orgasm. All of those things are are driven by healthy pelvic floor function. And so I think most women are like really eager to learn. They just have never had anyone tell them before. And so if you break out like those pictures and models and start to talk about it, they get excited and they want to see what they can do to make it better.
Yeah, I think that that's such a good point. Even for me personally, like coming into this space and realizing how much I feel like of a lack of education there is for so many people, kind of until a certain point. And I feel like oftentimes it's when folks have an issue is like kind of what drives
Hmm.
them to seek help and learn about this. So a lot of times you come in with kind of not a strong foundation of what is the pelvic floor? How does it work?
Hmm.
How does my breathing and the core and all that, come in together? And I think having a conversation like that with you is so helpful because once you're like, oh, this is all like clenching my butt or my breathing or my jaw and like
Hmm.
how tightly integrated those things are, you're like, oh, okay, this I don't know, it starts to make a lot more sense. And then I think that's where you start to really see that knowledge is power and people can,
Hmm.
I don't know, start to kind of take control of their bodies again if that's kind of, where things have gone for them. So yeah,
Yeah,
that
for
knowledge
sure.
piece I think is very important. Great.
Yeah.
Thanks for sharing that.
Yeah.
So with that in mind, I think we also see a lot of common misconceptions about pelvic health for various reasons. I think um, there's definitely this aspect of it's not a one size fits all approach. However, there's common things that apply to everyone. What do you feel like you see as some of the top misconceptions or the ones that maybe get under your skin the most?
Um, Oh man, there's so many. The first one is that urinary incontinence is a given as you age, that there's nothing that can be done about it. And it's just, it's what happens to women. And so you just need to accept it. I see that a lot where I will ask a patient, like, if they have any pelvic floor symptoms that they're concerned about, and then I'll get more specific, like, do you have any urinary leaking or leaking of bowel movements or, all these other questions. And then they say, yeah, but I'm not that worried about it. And in fact, it's impacting their life greatly.
Yeah.
They've just learned to live with it because no one else has offered them help. In the same kind of vein, pain with intercourse, oftentimes patients have talked with either another primary care provider or another gynecologic provider and been told that there was nothing they could do for them. And so no one's actually even assessed their pelvic floor to see if there was actually interventions that could be
Mhm.
helpful, or not to vilify anyone. Maybe they just don't have the training to actually
Right.
know how to assess the pelvic floor. Um, and then I think the other one is I'm a big proponent of vaginal estrogen in the perimenopausal and menopausal timeframe, but also for anyone that has low estrogen, whether they're breastfeeding or they're on an oral birth control pill. And so the misconception that hormones are like bad or scary,
Yeah.
it also, I see that a lot. And so we
Mhm.
have to re-educate about how important the hormones are to the pelvic floor function.
I feel like that's a really big one that people I think kind of have this immediate like whole body reaction to it. Like I've heard that those hormones, cause all these things to happen and I see that a lot and I feel like
Hmm.
it can be a steep thing to overcome with that re-education. And so it is so important because it's such valuable tools for people. And it's a shame, yeah, to have a misconception,
Hmm.
potentially prevent people from getting something that could really help them.
Yeah, for sure.
Yeah. Yeah. Can you share a success story with us? It could be kind of any range of someone you've worked with or multiple stories if you'd like to. But I feel like one of the things I found helpful in talking with people is hearing and seeing themselves and working with people like you who find success. So I'd love to hear one or two if you're up for it.
Sure. Well, one patient that comes to mind, again, she had had painful intercourse for years and been told that she couldn't do anything about it because she had a history of breast cancer.
Mm,
And in fact, you can use vaginal estrogen with a history of breast cancer in many cases. And we just work alongside that patient's oncologist to make sure that they're okay with the plan. And so this patient had hypertonic pelvic floor, so really tight pelvic floor
mhm,
muscles. And she had low estrogen, and that was causing the vaginal tissue to be dry and irritated and kind of causes like a friction feeling when you're
Mhm.
trying to have penetrative sex. And so, within a few weeks of just starting vaginal estrogen, and she went to PT and started on dilator therapy, she came back to me and told me her whole life was changed, her relationship was changed. She was actually tearing up. And that to me is just like an obvious example of like we can do these really low cost,
Mhm.
simple interventions that can make a big difference in people's lives.
Yeah, thank you so much for sharing that because I think that's a perfect example of how incredibly transformative it is. And it's not, months and years of something you have to do or thousands and thousands of dollars. It's like those are
Hmm.
relatively low barrier to entry things that can make a tremendous difference.
Yeah.
Yeah, amazing. Another thing I was curious to talk to you about is, of course, like I was saying earlier, I know that, pelvic health and things in this space are very dependent upon the person, but are there kind of more general or broad best practices that you can share with us that people can keep in mind for good pelvic health?
Sure. So, I mean, everybody, even if you don't have pelvic organ prolapse and you don't have urinary incontinence yet, unfortunately, it does affect many women as they age. You can do things now to keep your pelvic floor healthy. So, one of them is staying hydrated. And so a lot of people come into me for urinary frequency, like overactive bladder. They're peeing all the time. And they think that the solution is to just like drink less and less and less. But that actually causes your bladder to get more and more irritated over time. So drinking half your body weight in ounces of water a day, eating a lot of fiber so that you can keep bowel movements regular, because the more you have to push, the more strain that puts on the pelvic floor. So a good goal to aim for is about 30 grams of fiber a day for most people. And just start slow. Don't do that overnight, and get most of it from your food. It'll be a lot harder on your stomach if you're taking it in supplements. Using a squatty potty is another one, just or a stool to elevate your feet when you are going to the bathroom. Helps again to relieve pressure on the pelvic floor. And also use lube when you have sexual activity.
Great. All great tips. Thank you so much. I feel like it's very helpful to hear those because I don't know, sometimes, especially with the education aspect, you can feel like, well, I don't know, what can I do in my day to day and kind of take direct control of, even if I don't have issues. So I think hearing those things are really helpful, especially for
Yeah.
simple kind of day to day stuff to implement. That's great.
Yeah.
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 Will you talk a little bit about kind of how we should think about pelvic health or kind of taking care of our body in that way over the course of our life from a woman's perspective? So thinking of it, I feel like a lot of times it's during pregnancy or early postpartum when people may first be introduced to that, especially I think with what we kind of, or at least what I'm seeing right now. And then of course, again, as you go through menopause, will you just kind of talk high level? Because I know you could get into tons of
Hmm.
detail, but just about how
Hmm.
like a general person could kind of think about this during those different life phases.
Sure. So I think like in your teens and 20s, a lot of times we don't see as frequently symptoms, but symptoms to definitely get seen for. And you can start out with your women's health provider, or you can go straight to pelvic floor PT, whichever one you're more comfortable with. Is like if you have pain with intercourse all of the time, if you have constipation, if you feel like you have to pee all the time, if you feel that your birth control methods might be causing things to change in your pelvis, those would all be times to get checked out and maybe to have one or two visits with a pelvic floor PT. And then if you do have a pregnancy and you're postpartum, again, great to get into pelvic floor PT if you can. I know that it's not accessible to everyone, so there are other ways to access some of those resources through some online programs and books. But I highly value pelvic floor PT if you're able to access it. And then as you age, like 30s, 40s, perimenopause tends to come a lot sooner than people think that it's going to. So average age of menopause is 52, but perimenopause, the hormone changes that happen before menopause, can start in your late 30s to early 40s. And so that would be the time to really just start kind of tuning in, tracking your cycles, making sure that you're kind of aware, like, what is your baseline health? So that you'll notice if you start having changes, vaginal dryness, urinary frequency, you start having any kind of urinary leaking, or feeling other symptoms of perimenopause like mood changes, body aches and pains, that kind of thing. So that you can, again, go into your provider if you notice that things are starting to change or you want to talk about treatment options. And then unfortunately, in menopause, it does become much more common to have pelvic organ prolapse and vaginal dryness, urinary incontinence. And a lot of that is related to hormones, because when we lose the estrogen in the pelvis, then those muscles, they are become more lax. The bladder becomes affected, and so getting treatment for that, if it's starting to affect you, is really important.
Great. Thanks for sharing that. I think it's helpful just to hear, depending on, for anybody that's hearing this, they'll be in any of those different life stages. And I think hearing about it in all of those is great. Will you tell us a little bit about what you find to be the most rewarding part of your work, both as an educator and as a practitioner?
Yeah. As an educator, I love seeing the transition of my students from starting out, kind of insecure or not used to not being the expert because they were all nurses before. And so they come in kind of unsteady, and then to see them really become the expert and take independence and really take ownership of their patient's care is really rewarding to see, and to see how then they go and make a difference in their own communities. And as a provider, I really love to see just the little wins. Like I remember one patient, she was eating almost no fiber at all, and was very constipated, and it was really affecting her pelvic floor. And she was she had a lot on her plate. She had kids, a job. And she came back and she was just so proud that she had started doing, adding some foods that were high in fiber to her breakfast, and like felt so proud that she had taken that step. So I really like seeing even those little wins that patients make to improve their health.
Yeah, that's so great. I would also love to hear, can you just tell us a little bit about like your vision and what you have planned for Aspire Women's Wellness?
Yeah. So this dream started a few years ago, because I looked around and I just didn't see the kind of practice that I would want to get my own care in, to be
Mhm.
honest. I have some chronic health issues and endometriosis, among others. And so I know what it's like to have to manage your own care and coordinate your care. And
Mhm.
so I want to be that person. I want to provide holistic care where I am working closely with your pelvic floor physical therapist, your dietitian, and kind of being that person that can help direct you, and not feel like you have it all on your shoulders. And also to be a resource for things that often go untreated or unnoticed in
Yeah.
typical OBGYN clinics. So oftentimes those clinics are really busy. They have a lot of different things going on. And so you don't have the time to really sit down
Mhm.
and talk for an hour about what changes have happened in your sex life and what do you want to do about that, or how are your hormone changes really affecting your day-to-day life. And so yeah, our vision is to have long visits, 60 to 90 minutes, really get to know our patients and help them to make holistic health changes that can really impact their quality of life long term.
Amazing. I think it's so exciting and such a, a welcome option in this space. And I think even just like the longer visits, I know from personal experience, like you said, you'll see a doctor and they only have so much time. And I'll often be like, oh, I didn't like get into this, or I forgot this thing, or you can
Mhm.
kind of only cover so much ground like when things are moving that quickly. And I think having that longer dialogue and the relationship too that it builds with, someone like yourself, that as well is so impactful because I think I don't know, it creates that space where you get to feel heard and you get to, I don't know, really have just like that sounding board and that trusted
Mhm.
relationship. And then you get to feel more confident that whatever, these things are that you're dealing with are, in the hands of a trusted professional that really knows who you are versus, in and out. So
Yeah,
that's amazing.
yeah.
I'm really excited to stay tuned and yeah, see how you grow.
Thank you. Yeah, I really
Amazing.
believe that there's like a therapeutic benefit in just in hearing people's stories. So just having the time to listen to all of these things that they've gone through and all the things that they've tried. I often see patients feel better just walking out of the room after getting it all off of their chest.
Yeah.
So we really want to make space for that too.
Yeah. Yeah. I think that's 100%. Yeah, that resonates. Well, amazing. We're coming to the end of our discussion. Is there anything else, any parting thoughts you'd like to leave us with?
I think just that your pelvic floor health and your gynecologic health in general is really worth the investment. And I know women put so much into so many other people and so many other places. And so I just encourage people, if you feel like you need the support, to reach out and get it because your health is worth the investment too.
Absolutely. Thank you so much for your time today, Lillian. We really appreciate it.
Thanks for having me.